Vijay Yodandi. I've been an educator all my life, a health professional for the last 3 decades. And the most important thing in my life has been my desire and ability to care. Very early in my life, I thought how wonderful it would be if I were rich and powerful. Then I would have the ability to bring about all of the change that is needed to make this life wonderful. And yet, as I have grown older and learned more and more from all of the greatest people on earth, I have come to the realization that, in fact, power is an illusion. Authority is a delusion. Responsibility is reality. And therefore, we must care. HAPPEN is Healthcare Advancement Peer Partners Empowerment Network, a product of over 3 decades of my career as a healthcare provider, as well as a lifelong educator training students, residents, and fellows in the United States as well as India. I started out as an infectious diseases specialist caring for immunocompromised individuals, particularly those who have HIV/AIDS and transplant recipients. In 1985, I joined Science, Health, Allied Research Education, founded by expatriates in the United States and visionaries in India, to bring advanced healthcare to India. And thus began my dive into public health, particularly in the area of infection prevention and HIV. Over the years, my obsession with patient safety and prevention of infections has inspired me to learn about the systems approach to health as the means to improving population health. I have been uniquely blessed to have had the privilege of working with many wonderful professionals from the United States and India who taught me more than I could have ever imagined. I and my colleagues at SHARE have launched this endeavor to bring together a multidisciplinary approach to the concept of health through HAPPEN. Our vision is One Health, integrating humans, animals, and the environment through HAPPEN. At SHARE, our mission is to rise to healthcare leadership. RISE is respect, a partnership in a shared vision, innovation, approaching complex adaptive systems through empowered peer group networks, skills in participatory action research, and empathy, unreserved benevolence. So why HAPPEN? Throughout my career, what has distressed me the most is how the healthcare system has ended up actually hurting patients rather than helping them. Very often, patients end up being much more incapacitated by the treatment than the disease for which they sought help. Indeed, many years ago, Lord Hutchison warned us from making the cure of the disease worse than the endurance thereof. Good Lord, save us. It is true that advances in medical technology, particularly examples such as vaccination, have saved innumerable lives. It is also true that advances in technology have fueled an industry that creates a demand for ever more expensive treatments and interventions, some of which are of questionable benefit. Spiraling costs of healthcare consume an ever-increasing part of resources that are diverted from other more pressing needs. Increasingly, healthcare services have been captured by a growing medical services industry that is dependent on more and more expensive technology, making it a luxury accessible only to the elite. Ordinary citizens find it increasingly difficult to access affordable healthcare. Indeed, whatever healthcare is provided is often fragmented and chaotic. Healthcare providers and even recipients are seduced by technology and are convinced they have superior care. Unfortunately, this medicalization of healthcare has created many perverse incentives, encouraging a mercenary approach using marketing pressure to generate demand for services and products that have more to do with enriching the medical services industry rather than improving the lives of individuals and populations. The high-cost, high-technology medical industry has directly or indirectly starved resources needed to provide basic services to the underprivileged, contributing to increasing social injustice. Desperately needed investments in improving population health through essential infrastructure in sanitation, public health interventions, preservation of the environment, regulation of agricultural and industrial practices impacting on healthcare have steadily eroded. Although reform of healthcare is increasingly recognized, interventions have also been fragmented and incoherent. Over the last few decades, we have seen increasingly a temptation to resort to technological fixes rather than a true evaluation and intervention based on a systems approach. Very often, health services are transactional, with the provider being portrayed as a benefactor and the recipient characterized as a beneficiary. Increasing technology necessarily begets greater and greater specialization, and in concert with a medicalized approach, makes the healthcare intervention fragmented, incoherent, impersonal, and tragically mercenary. Indeed, healthcare is now increasingly better characterized as sick care. The entire system is geared towards intervention after illness has occurred, with minor attention paid to prevention and almost complete neglect of promoting good health in rehabilitation or restoration. It has been argued that the conventional approach to understanding health-related issues is anchored in the concept of pathogenesis, where mechanisms of disease and the definition of disease are the basis of designing interventions. This paradigm is deeply flawed as it ignores the fact that individuals who have medical conditions vary greatly in their capability to cope with the demands of life, with responses that vary from minimum to complete incapacitation. The conventional approach does not adequately allow an appreciation of the continuum of health conditions in individuals and populations that are a complex adaptive system. A profound understanding of health-related conditions and interventions in individuals, families, communities, and therefore populations requires a systems approach. Health is also a deeply personal issue with a significant emotional component. It is imperative for healthcare providers to have the ability to understand and empathize with healthcare recipients. Equity in access to all health services is essential for social justice. A participatory approach where providers and recipients are partners in a shared vision of health is the clear need of the time. A shared vision requires that the goals as well as the metrics of any intervention be crafted through a participatory approach. The paradigm of salutogenesis that was articulated by Aaron Antonovsky provides a superior model for arriving at a shared vision of health. Here we look at everyone holistically with the understanding that health and disease represent a continuum. As everyone must cope with the demands of life, the ability to do so is critically dependent on the individual's sense of coherence. The primary goal of health services must be to promote a sense of coherence in individuals, families, communities, and populations. The specific set of interventions are therefore based on a comprehensive analysis using real-time adaptive management of health programs using a systems approach. Examples include an appropriate mix of technology such as vaccine, nutrition, sanitation, and the applications of interventions to build social capital through bonding, bridging, and linkages. An obvious implication is avoiding the false dichotomy between communicable and non-communicable diseases. Building and optimizing healthcare solutions also requires interventions to improve equity of access to the entire continuum of promotional, preventive, primary, and tertiary care anchored in social justice. HAPPEN, in summary, is a framework for participatory action research anchored in the concept of salutogenesis. Here, the vision is One Health. Human health is possible by addressing the continuity of the environment, animals, and humans in a complex adaptive system. This is a cartoon of a complex adaptive system where multiple agents are interacting with each other and are encompassed within a boundary within which are many attractors. Other inputs are the environment in multiple interlinked nonlinear equations. It is important to understand that unlike classical Euclidean or Newtonian linear equations, almost all of nature has very complex nonlinear equations. Although these appear to be superficially unpredictable and completely random, they do exhibit patterns that are repetitive, scalable, and are in fact amenable to analysis and mathematical description. The concept of a complex adaptive system helps us to better understand the health of individuals as constituent members of families, that are constituent members of communities, that are constituent members of populations and society. In designing interventions as well as monitoring implementation, it is necessary to utilize adaptive management strategies to improve the probability of arriving at desirable goals. This is the Newton's cradle, an example of classical physics described by linear equations. However, in nature we see many complex patterns that cannot be described by linear equations. This is an example of Benoit Mandelbrot's fractal geometry. All of biologic systems exhibit some form of fractal geometry as exemplified in this picture. All of these patterns appear to be unique and completely random. However, in reality, these are complex systems that can be described mathematically using nonlinear equations. An essential component of understanding this is the science of chaos theory, a branch of mathematics focusing on the behavior of dynamical systems that are highly sensitive to initial conditions. Chaos is an interdisciplinary theory stating that within the apparent randomness of chaotic complex systems, there are underlying patterns, constant feedback loops, repetition, self-similarity, fractals, self-organization, and reliance on programming at the initial point, known as sensitive dependence on initial conditions. The butterfly effect describes how a small change in one state of deterministic nonlinear system can result in a large difference in a later stage. For example, a butterfly flapping in its wings in Brazil can cause a hurricane in Texas. Small differences in initial conditions, such as those due to rounding errors in numerical computation, yield widely diverging outcomes for such dynamical systems, rendering long-term prediction of their behavior impossible in general. This happens even though these systems are deterministic, meaning that their future behavior is truly determined by the initial conditions, with no random elements involved. In other words, the deterministic nature of these systems does not make them predictable. This behavior is known as deterministic chaos, or simply chaos. This theory was summarized by Edward Lorenz as: when the present determines the future, but the approximate present does not approximately determine the future. Chaotic behavior exists in many natural systems, such as weather and climate. It also occurs spontaneously in some systems with artificial components, such as road traffic. This behavior can be studied through analysis of a chaotic mathematical model or through analytic techniques such as recurrence plots and Poincare maps. Chaos theory has applications in several disciplines, including meteorology, anthropology, sociology, physics, environmental science, computer science, engineering, economics, biology, ecology, and philosophy. The theory formed the basis of such fields of study as complex dynamical systems, edge of chaos theory, and self-assembly processes. The Barnsley fern created using the chaos form. Natural forms such as ferns, clouds, mountains, etc. may be created through an iterative function system. Thus, this is an example of how the complex pattern of a fern can be described mathematically and be reproduced by the aid of a computer using an iterated function system. The double round pendulum animation showing chaotic behavior, starting the pendulum from a slightly different initial condition, would result in a completely different trajectory. The double rod pendulum is one of the simplest dynamic systems with chaotic solutions. The Lorentz equation used to generate plots for the y variable. The initial conditions for x and z were kept the same, but for y were changed between 1.001, 1.0001 and 1.00001. The other values were 45.92, 16, and 4 respectively. As can be seen, even the slightest difference in initial values causes significant change after about 12 seconds of evolution in the three cases. This is an example of sensitive dependence on initial conditions. A complex adaptive system is a special case of a complex system which is also adaptive. That is, it has the ability to change and adapt itself to the environment. Typically, it consists of a large number of interactive adaptive agents. Complex adaptive systems are used to understand events, objects, and processes in their relationship with each other. They are complex, they are diverse, and made up of multiple interconnected elements and adaptive. They have the capacity to change and learn from experience. They are systems where a lot of individual adaptive agents interact and communicate with each other. Complex MAS with adaptive agents. The agents of a complex adaptive system learn and change as they interact with each other. The name complex adaptive systems has been coined at the interdisciplinary Santa Fe Institute by John Holland, Murray Gell-Mann, and others. John Holland is one of the inventors of evolutionary computation and genetic algorithms. Nobel Prize laureate Murray Gell-Mann discovered quarks. Happen uses an inclusive participatory approach where all stakeholders are partners working together. Peer groups are essential since they together provide the means to create synergy by bonding, bridging, and providing linkages that enhance social capital. Peer groups also efficiently transmit knowledge and behaviors through snowballing. Networking within peer groups and across various groups and stakeholders, transcending boundaries, are a powerful means to establish and promote best practices. Happen will use many different techniques such as structured and unstructured interviews, focus groups, photo voice to assist in the evolution of strategies for promoting health. Network analysis is a powerful tool to understand the role of change agents and dissemination of attitudes, behaviors, as well as communicable diseases. Happen will use participatory action research that is a combination of both qualitative and quantitative methods integrated into the MyCurch model adapted to a One Health concept. The MyCurch model states that health is a state of well-being emergent from conducive interactions between individuals' potentials, life's demands, and social and environmental determinants. Health results throughout the life course when individuals' potential and social and environmental determinants suffice to respond satisfactorily to the demands of life. Life's demands can be physiological, psychosocial, or environmental, and vary across individual and context. But in every case, unsatisfactory responses lead to disease. HAPPEN will pay attention to mother and child programs to fully develop potential conferred at births, along with the mitigation of adverse heritable attributes. HAPPEN will work to enhance a lifelong acquisition of attributes to promote health and meet the demands of life by creating programs integrating individuals, families, and communities with animals in a conducive environment. Conservation and restoration of degraded environment is a key imperative. It is also important to understand that animals are a potential reservoir of pathogens that cause human disease. Animals, however, can also be a source of joy and pleasure for humans. So please join the HAPPEN Club. Participation is entirely voluntary and no fees is required. Please send me an email at my address, mygdirector@hotmail.com. Also, like us on Facebook. We will keep you informed about didactic and interactive learning sessions as well as exciting opportunities to participate in projects. So please, like Gandhi says, be the change that you want to see in the world.